Every once in a while, you hear a politician take on a topic that is really important and they challenge the narrative. And Senator Rand Paul in the USA is one of those people. And I'm going to show you a clip of a recent interaction between himself and the former CDC lead, who has just recently been removed by RFK. And in a sense, it was an opportunity to challenge what she was thinking and what she was saying. And I'll play the clip for you, and I will then be sharing with you some data from the CDC with regards to hospitalizations. And this is what it looks like. We'll be looking at very quickly the April 2025 update, and specifically, we'll be looking at the issue with pediatric associated hospitalizations, because this is what the focus was in the conversation. So let's get straight into that discussion, for which I'll interrupt a little bit so that you understand my perspective on it as we listen to the conversation between the two of them. So let's get going with what was said.
Does the COVID vaccine prevent transmission?
The COVID vaccine can reduce viral load in individuals who are.
Does it prevent transmission?
When you have reduced viral load, you will have reduced transmission.
But in other words, it doesn't prevent transmission. You can still transmit the virus if you've had the vaccine. In fact, there's been reduced ability to interfere with transmission over time. And what we've found is the most recent one since Omicron is down around 16% reduction, if there is a reduction. Does the COVID...
I'll pause there a second. And so, by the way, this is from Vigilant Fox. So this video clip on Twitter or X came from his work, where he put in the subtitles just to credit the people who have put this up. But he raised the point with regards to transmission. And I think that I certainly have known this for many, many years, that an injectable vaccine is not very good at stimulating mucosal immunity. Now, it's different with something like, say, a measles injectable vaccine, because the virus has to go from the upper airway, spread through the bloodstream to get to the lower airway, where it can then spread again. So it has a circuitous route. So if you interrupt it in the bloodstream, you can then reduce or prevent the transmission of the virus. That's different. But in a respiratory virus, where you need mucosal immunity to stop the virus from spreading, so in effect, the COVID virus infects the same cell and spreads from it to other cells or elsewhere, because you don't have good mucosal immunity, this was always going to be a challenge. And truthfully, we could see this evidence all around us all the time. And this is the problem, is that when there is no acknowledgement of the very obvious things happening, COVID is still circulating in highly vaccinated regions. It suggests, therefore, that no matter what they have done, they haven't been able to stop the transmission. And pretending otherwise does not help anyone to trust any vaccine further. And this is why I'm differentiating it. There are some unique characteristics about this virus that makes it, in my view, very difficult to create a vaccine that can work for it. That's just my opinion after looking at the science for many, many years. Some viruses are like that. Dengue is an example. Not very easy to create a vaccine which doesn't cause problems. And so you have a situation where you have a highly mutable virus, not easy to stop transmission. You're chasing your tail and then pretending that somehow everything you've done has worked, damages trust in science. And so it's important to note that this is very unique to COVID vaccines, and it is different for some of the other tried and tested vaccines. Let's move on to what he has said.
Vaccine reduce hospitalization for children under 18?
It can.
It doesn't. The statistics are inconclusive, and the reason you can't prove that it does is there's so few people under 18 that go to the hospital. The numbers are extraordinarily small. There's like 76 million kids under 18 in our country. 183 died, and a few thousand went to the hospital in 2020 and 2021. And since then, the numbers have dropped precipitously, and the idea and the issue needs to be discussed. But the COVID vaccine is not reducing hospitalization. It's not statistically significant. Does the COVID vaccine...
Pause there again. And so he made a very important point. And again, if you understand the science about severe COVID, and I've explained this before, is that severe COVID is characterized by microclotting, tiny little clots in the blood vessels that block the movement of blood and cause people to get short of breath very quickly. You don't really get that with children. Children can have a viral pneumonia, like an influenza pneumonia, where the virus is causing inflammation and you get secondary bacterial infection, and they can therefore get quite sick with that. But if you don't understand the difference in terms of severe COVID with microclotting versus a viral pneumonia, this won't really make sense. And it highlights the important point that many of the decisions that were being made under the guise of science were really assumptions based on other conditions rather than based on a detailed pathological understanding of the disease. If they had looked carefully in terms of autopsies and looked carefully, you would find that proper severe COVID with microclotting is more like a vasculitis, inflammation of the blood vessels in the lungs. Not quite the same with a viral pneumonia that you would see in a child. Let's move on.
Vaccine reduce the rate of death for children under 18?
It can.
Once again, it can. That's a ridiculous answer. No, it doesn't. And there is no statistical evidence that it does reduce the death rate. These are statistics. We've looked at it.
So again, you can see the problem that they're facing is that you have to realize that they pushed vaccines on children, and this is across the world. And from my perspective, when I spoke with Dr. Ross Jones in early 2022, around the time that they were thinking of doing this in the UK, she was a retired pediatrician. She called it out immediately and said it didn't make sense. It was not the right thing to do. It didn't fit the science. And people got censored for that. And now that there is a reversal with the policies, there is no apology or no acknowledgement that, okay, maybe we're overzealous with regards to that, and therefore we've changed direction. Instead, in the US, they're still pushing for children to be vaccinated. Now, I may have a slightly different thought on this, and I'll explain to you why when we look at this data. And this data, as I said, is from the CDC itself. And they were looking at COVID hospitalizations across the board from April 15, 2025. And I just wanted to highlight a few points as to why I think that there is an important question that needs to be answered. When we look carefully at COVID hospitalizations over the period of time, and so this is showing you per age group, less than 6 months, 6 months to 4 years, 5 to 11 years, 12 to 17. And you can see in the period 6 months up to 17 years, really a fraction of children were hospitalized compared to what you see in the older age groups, all the way up 18 to 49, a bit higher, 50 to 64. And this is the characteristic of COVID. It was a comorbid disease or a severe disease in association with age. But if you look at the less than 6 months, you can see here that these children also were admitted to hospital in relatively higher numbers. But I think that's because little babies, any little infection that they get will potentially put them at risk for hospitalization because their breathing is not particularly as strong, they're developing their lungs and so on. So it's not that they have severe COVID, It's just that very often you will admit a child for observation when they are a bit more unwell. You won't take the risk of them being at home. And that's probably why they were being admitted in higher numbers. When you look at the CDC data again, comparing children and looking across this, and this was divided again into the age groups, and at the top in dark blue is the over 75s, and at the very bottom are the children. Now, what you will notice is that if you look in 2020, the numbers were quite low, and then it gradually starts to increase over the period of time from about late 2021 and gradually starts to increase in terms of hospitalizations. This was one of the interesting things that I noted, and it should have been answered. Why were children at lower risk early in the pandemic and seem to have slightly higher risk with regards to hospitalization as time went on? And again, in this picture, you can see it. Now, again, they're only showing you this part from 2022. So you can see these spikes in terms of hospitalizations. But that's this period here. But if you again look from the beginning of the pandemic, the numbers were much lower. And this spike didn't occur until after 2021 into 2022. This may have been the Omicron wave. And one of the questions that I have been contemplating or wondering about is, did the process of what happened in terms of the pandemic put children at risk because there were such broad vaccination policies? In effect, my suspicion is that because we know there's an association between the higher the number of vaccines, the higher the IgG4, the higher the risk of infection, did reinfections among parents of children, so parents who are vaccinated, children therefore get more exposed and increased risk over time? I think that's a very important question to answer. Now, it's just my opinion, and this is something I've been thinking about for some time, but it really, to me, seems like a very relevant point. The other point that I wanted to mention, and I'm trying to show you this here, when they talk about children dying with COVID, and I have to emphasize again, viral pneumonia, they don't really get the microclotting. If you understand that the microclotting in the lungs is related to almost, as I said, a viral mediated autoimmune response, still a lot of people in the scientific community don't understand what I mean, that severe COVID was more like a lung vasculitis. Believe it, that has gotten censored in the past. So take it as you will, but this is what triggered the microclotting in the lungs. And this is why things like steroids and immune suppression work. But the point is that that mechanism does not really happen in children. And that's where the difference is. So they need a different approach. Now, when he spoke about the numbers, Rand Paul, and he said that the numbers were so small that they couldn't be statistically significant, look at this image here. So they were looking at 1 in 5 children and adolescents with COVID-19 associated hospitalization are admitted to the intensive care unit. And they were looking at percentages here across that. Now, that is significant that they were in intensive care. And these numbers look quite significant in terms of percentages. But when you look at the bottom here, during this period, 7 children with COVID-19 associated hospitalization died in hospital in the COVID net catchment area. What this indicates is that when you're talking about percentages, it looks very high, but 7 children across the United States, even though people get sick, I am not sure, when I think about it objectively, if this is serious enough for you to warrant mandating and forcing vaccines in children where they have developing immune systems. You don't know the longer term implications. And if you've been following me, you'll see all the questions I've been asking that need to be answered, in my view. And everything is about a risk benefit. What they have done, in my personal opinion, is that there has been so much focus on the science around trying to justify what was done with regards to COVID vaccines, that they have lost the ability to recognize that they are in the process damaging all vaccines. They are literally sacrificing all of the work that had been done for 50 or 60 years with regards to measles, mumps, rubella, diphtheria, tetanus. All of that work is going to be dismantled because they don't want to acknowledge that COVID vaccines are not at all in the same league. Now, some people may get upset when I say this, but I'm telling you that if you understand the science, as I said, I am not even convinced that a vaccine in the context of transmission and safety across the population with COVID can actually work properly. For severe disease or for people who are at very high risk in 2021, if they had not been exposed to the virus, I would say, listen, it's worth taking the gamble. That's as far as I would have gone. Anything beyond that, I thought was too high risk. And it's turning out to be this way, but there is very little acknowledgement of this truth. So the point is this. I think that she did have a hard time, and she is a microbiologist. She has been working in the CDC for some time, and it has been painful for her to be able to have to go through that. But on balance, I think Rand Paul was probably accurate. And so for the people who haven't seen this yet, I will play the straight 1.5 minute section. You can judge for yourself whether or not what he said made a lot of sense. Here we go. Oops. Sorry, that's me messing it up.
Does the COVID vaccine prevent transmission?
I'll get it for you in a second. Here we go again.
Does the COVID vaccine prevent transmission?
The COVID vaccine can reduce viral load in individuals who are
Does it prevent transmission?
When you have reduced viral load, you will have reduced transmission.
But in other words, it doesn't prevent transmission. You can still transmit the virus if you've had the vaccine. In fact, there's been reduced ability to interfere with transmission over time. And what we've found is the most recent one since Omicron is down around 16% reduction, if there is a reduction. Does the COVID vaccine reduce hospitalization for children under 18?
It can.
It doesn't. The statistics are inconclusive, and the reason you can't prove that it does is there's so few people under 18 that go to the hospital. The numbers are extraordinarily small. There's like 76 million kids under 18 in our country. 183 died, and a few thousand went to the hospital in 2020 and 2021. And since then, the numbers have dropped precipitously, and the idea and the issue needs to be discussed. But the COVID vaccine is not reducing hospitalization. It's not statistically significant. Does the COVID vaccine reduce the rate of death for children under 18?
It can.
Once again, it can. That's a ridiculous answer. No, it doesn't. And there is no statistical evidence that it does reduce the death rate. These are statistics. We've looked at it.
As I said, that was like an evisceration. Ouch. Well, as I said, hopefully that made sense for you. Remember, in the description is the link to Humming Heroes. The free PDF version is there, and the link to get the version on Amazon. It was our #1 book, one of them. So please support us in any way you can. Remember to subscribe, like, comment, and share this information with others around you. We really appreciate your support. Have a great evening.
A hero, an immune adventure. Humming Heroes, your lyrical guide to the body's defenders. Now on Amazon. Check the links below.